Welcome to Washington Unplugged. I'm John Dickerson. Healthcare reform passed in a squeaker this weekend in the House of Representatives. The president called it historic. Sure, but 39 members of the president's own party didn't want to sign up with history. Other pro-choice Democrats were concerned that the bill limits abortion rights. One of the members of the House who did vote for the bill was Congressman Anthony Weiner. He joins me now from New York. Congressman, thank you for being with us. Tell me why this vote was so close.
Well, it's so close because we were taking on two very powerful forces. The status quo, which is always difficult to shake because so many people are invested in it, and the healthcare lobby. You know, the health insurance industry makes an enormous amount of money on the inefficiencies that exist in the system. They didn't want any more competition, didn't want any more restrictions. And when they work hard to stop something, they start out with the entire Republican Party, and picking off a few Democrats along the way is always their goal.
39 Democrats were picked off in this case. That seems more than just a few. How are people to think about the 39 who didn't vote with the president and the rest of their party?
Well, we hope we're going to get them back when this process nears the end. They were cautious for a bunch of different reasons. Many of them wanted more cost savings in the bill, and frankly, so do I. I think that's one of the reasons why we need a stronger public option, is because it provides more competition and more choice and savings for the taxpayers and for people that buy insurance. Others of them had just general concerns about how the bill would affect their districts. I don't want to criticize anyone who voted no on the bill. So long as we have 218 votes and this winds up on the president's desk with a Rose Garden signing ceremony, then I think we'll be okay. But as you can tell from that total, we don't have too many more votes to give.
Tell me, Congressman, about the abortion language in this legislation. There's been some controversy about it. A lot of your pro-choice colleagues, or allies, I should say, have said that this is too limiting, that this is really abusive. What's your sense of that?
Well, of all the bitter pills we had to swallow to vote yes, this was perhaps the bitterest one for many of us. You know, right now there's language in the present law that says that no federal dollars will go for abortion services. It's kind of a compromise, although an uneasy one. But now this amendment that was added said that even women with their own money are going to have a difficult time going out and buying insurance policies that cover reproductive choices. That's a real problem, because what that winds up telling you is that even someone with their own money not being able to buy a service, that's the biggest restriction we've had on abortion services, frankly, any time since Roe v. Wade. And it's regrettable. If it comes back with that same language from the Senate, I think the Speaker is going to find a much tougher job rounding up the votes for the final version.
So it's going to have to get weaker as it comes out of the Senate rather than stronger or stay as it is.
Well, I think that language is going to have to be changed some. A lot of members I saw on the floor on Saturday night who said they were voting for this said, I'm not going to vote for it if it comes back with the same abortion language. A lot of us are in the same mindset. We want to move this process forward as much as we can, but the final bill is going to have some things that are not in there, and some things that are in are going to have to be changed.
So when we're doing the nose counting here, as you say, it was a close margin here. When you say a lot of members mentioned that, are you talking half a dozen, a dozen? How many are on the line here?
Well, here's what I would say. I think that you have in risk about 20 votes here in the House in the House of Representatives if you don't either strengthen the public option or water down the abortion language, or both. You know, there are elements of this bill that people who voted for it are still dissatisfied with. That's the way it is with legislating. So I think this is still a tenuous situation in both houses. But this is kind of like in a football game. The defenses always get stiffer when you get close to the goal line. That's what the president is experiencing, and I think what we're seeing in the Senate as well. But the opposite force is also happening. More and more Americans are realizing that this is going to get solved this year. More and more people are calling up their congressmen and senators saying, I want this to be a reality. So hopefully it'll wind up coming to pass, but it is not a done deal by any stretch of the imagination.
Indeed, it goes to the Senate now, where Lindsey Graham, a Republican, said the House bill, the House version, is dead on arrival. We have moderate Democrats who don't like the public option at all, and then we have Joe Lieberman, who's talked about filibustering the bill. What's your feeling about the Senate, and isn't the bill going to get weaker on those provisions you say are crucial to picking up those 20 votes?
It's still complicated, there's no doubt about it, but I don't think we want to be taking handicapping advice from Lindsey Graham. He's basically said he's voting no matter what we do, and so he's not necessarily who we should be looking to. Joe Lieberman is a different problem. You know, you can favor the public option or oppose it, but it sounds like Senator Lieberman's position is that he wants there to be no vote one way or the other, up or down. If people get dug into that mindset, that would be truly regrettable. This is an important enough debate that every senator should have a chance to have their say. But the summary situation is this. It's complicated. There are members on the right who will peel off if we do too much to satisfy people like me, and there are obviously people on the left who will peel off if we do too much to accommodate the likes of Joe Lieberman.
What do you say to your Democratic colleagues in the Senate who are, which would not include Joe Lieberman, but who have issues with the bill and who've said they might vote with Republicans or might otherwise block health care from going forward?
Well, what I would say to Democrat and Republican alike is let's have a vote in the Senate on these issues. I think if the senators are left to vote, I think we're going to wind up with a pretty good product at the end of the day. The way the Senate works, unfortunately, is it takes a relative small number to stop anyone from even having access to their choice. And that's what we have to push back against. We really do need, at this point, we need the president to be actively engaged just about every day on all of these issues. And what I would say to Joe Lieberman, any other recalcitrant senator, is let's just have a vote on these various issues. If 51%, if a majority rules, I think the product will be pretty good.
Speaking of the president, he came in at the last minute in the House here. How helpful was that? He came down and paid a visit and then gave a speech afterwards. Did that change anybody's mind? Did that move this thing forward?
Well, I think the president's intervention at the end was very helpful, and we need him there to keep that finger on the scale. Look, the fact is that a lot of members of the House and the Senate want to be sure that if they run up this hill, take some difficult votes, that the president is going to back them up and that we're going to make sure that this winds up being a product that everyone can be proud of. The president can't sit back and hope this works out. We in the House and Senate really need his leadership.
Last final question, which is some of your allies on the left, MoveOn.org, is spending is spending a great deal of money going after those Democrats who voted against health care reform. Is that helpful to the cause and helpful to Democrats?
Well, they shouldn't be targeting people who have legitimate concerns that we might still be able to work out. I mean, I do think people who are ideologically bent on keeping the status quo in place, frankly, I think history is not going to speak kindly to them, nor will their constituents. One thing that I would ask all of my colleagues to remember is many of us got elected saying we're going to fix health care, and that's not just in liberal districts in New York City. That's all across the country. I have a website, countdowntohealthcare.com, where we ask people to sign a petition for the public option. And when we went and looked at the zip codes of those different, of who was signing up, they're from all over the country. This is not a regional thing. So to my colleagues who are standing in the way, I think they're going to find their constituents don't want them to, let alone organizations like MoveOn.
Okay, Congressman, thanks very much for being with us.
It's my pleasure. Thanks for having me.
From the House healthcare, now it moves on to the Senate, where the journey will be even rockier. Republicans are unified in opposition, several Democratic moderates are opposed to various provisions, and independent Joe Lieberman has threatened to filibuster. Senate Majority Leader Harry Reid has even hinted that the timeline may slip into 2010. Joining me from Capitol Hill is the Washington Post's Lori Montgomery and CBS News producer Jill Jackson. Jill, I want to start with you. Congressman Weiner put the number of wobbly Democrats in the House at 20 when this bill comes back to the House. Does that sound right to you?
Well, at this point, it's a little early to tell. It's going to depend on what they work out. And as Anthony Weiner said, he wants a stronger public option. He wants weaker language on abortion. And as you pointed out, that's not really likely to happen. So it's a shaky road. If the language on abortion stays as is, which would bar folks who get subsidies from purchasing plans in the exchange that cover abortion, you're going to have some serious trouble with the 190 members of the pro-choice caucus in the House.
Lori, set the table for us in the Senate. What's going to happen there, and what do we need to be paying attention to?
Well, the first thing that we have to watch for is how Harry Reid puts this bill together. I mean, right now it's in Reid's office. He's meeting regularly with Chris Dodd, who put together the help bill, and Max Baucus, who put together the finance bill, which is expected to be the template for whatever the Senate does, as well as senior White House officials. So the first thing we have to see is how they resolve some of the issues that are still up in the air in the Senate, including this public option. I mean, Reid has said that he's going to go with a public option with an opt-out, but that is not really lighting any fires among moderates. And at least one Republican, Olympia Snowe, said she would like to see this thing go back to her trigger idea, whereby there would be a public option and states would be required to offer it if private insurance companies failed to make policies available that were broadly affordable. So, that idea is still very much in play, and there are a number of moderates who are behind it as well.
And who think that's where the end game is here. Where do we stand on the question of Ben Nelson or another of these moderate to conservative Democrats blocking the bill before it even gets to debate, blocking the motion to proceed? Is that still where things stand?
Well, Nelson has said that he doesn't, there are a number of very specific things that he's not wild about. One of them is the Class Act, which is this new government plan that would create long-term government insurance for long-term care. My understanding of that thing is that it's being, the CBO has taken another look at it, and maybe it can be resolved in a way where guys, deficit hawks like Nelson can be brought around. On some of the other issues, it's harder to say.
Jill, going back to the House bill for just a second, what did we learn about Nancy Pelosi from this process?
Well, in some ways, and we've seen it before, we reaffirmed that Speaker Pelosi is an excellent vote counter. She's had some squeakers this year, first with the energy cap and trade bill, now with the health care bill. We also learned that she's willing to really make compromises on her own beliefs in terms of this last-minute abortion deal that she made with Congressman Stupak and other pro-life Democrats. She is a pro-choice Democrat. She's also a Catholic, but firmly pro-choice. And yet she was willing in the end, when she realized there were maybe 40 votes that threatened to 40 Democratic votes that might go in the no category, she was willing to make that compromise in order to push this bill through and get it to that next step. And she was also willing to put pressure on her closest allies, some of the liberal women in the House and men too, but she was willing to put the pressure on them to accept this as well. And it was a tough vote for them to take.
What do we think about Harry Reid's nose counting, vote counting capabilities? Quite a different game in the Senate, but he's still got the same kind of backroom work to do. How good is he at that?
Well, Leader Reid it's easier. You don't have as many members, but at the same time, at this point, I think what he is seeing and why this is taking so long for them even to release their bill, aside from needing the CBO numbers, is it's very difficult right now to imagine any of the scenarios. A public option with a trigger, public option with state opt-out. It's hard to envision any of those scenarios getting 60 votes right now.
Lori, the president said after this was passed in the Rose Garden, he said, well, now the baton has been passed to the Senate, they must carry it over the finish line. But isn't he the one who's supposed to get this thing moving? I mean, the president, Harry Reid's powerful and all of that, but the president is quite a bit more powerful. And don't we expect him to get engaged here? And isn't there a real role for him with these moderate Democrats who are on the fence?
Yeah, and I think he's playing it. I mean, he's had people up to the White House. He's met I don't know how many times with Olympia Snowe, who I think they still hope will vote for this bill. But in the end, the president of the United States does not have a vote in the U.S. Senate. And, meanwhile, every single member of the U.S. Senate has the power to block this thing. I mean, Tom Coburn, a conservative Republican, has said he's going to read the entire bill on the floor. Now, that could take, I don't know how many days, but we're running out of time here. And the question is, how are they going to resolve this? Are they going to be able to even get the debate to a conclusion before Christmas hits?
What's your feeling about that? I mean, days are drawing short here. Leader Reid at one point seemed to suggest, okay, it might slip into next year. Then Rahm Emanuel had a conversation with him that may have changed. Where is your sense of the timing, and do you think they'll get it done this year?
Well, Jill and I were just talking about that, and we are very fearful, frankly, that we will still be here on Christmas Eve, and we both have shopping to do. But I think that it is likely that they will only be able, if they're able to get the debate finished and a vote before Christmas, they would be doing really good.
Okay. All right. Well, we'll end it there. Thank you, both of you, for joining us.
Thank you, John.
Thanks, John.
Thank you for watching Washington Unplugged, as more and more of you are now doing. Remember to join us again tomorrow at 12:30 on CBSNews.com. I'm John Dickerson.